Welcome, everyone. So, in our next session, we're going to be really discussing how to navigate supportive care. I think this is a very important topic as for many of our patients with neuroendocrine tumors, it's truly a lifelong journey. And throughout the journey process, you're going to need a lot of help, whether it's physically, emotionally, psychologically. All of that plays a pivotal role in terms of getting the best quality of life as well as outcomes while you're going through the treatment journey. So for this session, I'm joined by several of my colleagues. My name is Dr. Daneng. I'm a GI medical oncologist at City of Hope Comprehensive Cancer Center, and I'll let each of my esteemed colleagues introduce themselves. So I'll start with Dr. Banerjee.
Hi, I'm Dr. Banerjee. I'm an associate professor at City of Hope National Medical Center. I specifically work with palliative care and also do a lot of end of life and hospice care. Nice to meet you all.
Wonderful, welcome. And next, we'll go to Sheila.
Hi, my name is Sheila Lindsay. I'm a nurse practitioner. I work at UCSF Medical Center in the Neuroendocrine Center for Excellence there. I work with several colleagues at UCSF and help to navigate the patients through their journey. And I'm super excited to be here, so thank you.
Yeah, thanks for joining us. And lastly, Victoria.
Hi, yes, my name is Victoria Ramirez. I'm a licensed clinical social worker. I also have advanced certification in hospice and palliative care. I have about 12 years of experience as a social worker working with oncology patients, and I'm very glad to be here. Thank you.
Welcome to you as well. So I think we're going to just jump in right into the session. So as I mentioned, for many patients with neuroendocrine tumors, it's really a complex and long journey. And I think while you're going through this journey, partly, I think one of the biggest challenges is really navigating this uncertainty, right? How do you cope with the diagnosis of having neuroendocrine tumor, fears about potentially its prognosis, really kind of addressing the question of how long do I have to live with this disease? And then potentially it could be a long journey. You're going to be getting a lot of tests as well as scans, and there's kind of this phenomenon of scanxiety. So really focusing on this broad topic of supportive care, supporting patients in their journey and navigating them through uncertainty. I guess what are your pieces of advice in terms of how they should go about it, and potentially what services have you seen been used to effectively help them navigate this type of uncertainty? So I'll start with you, Dr. Banerjee.
Thank you. This is such an important topic, and it's so important for patients, and not just patients, but I think their caregivers. I think it impacts the entire family when someone has cancer, and especially with something like neuroendocrine tumor, as you said. Navigating is one of the hardest challenges. So, my advice always is really get palliative care involved early. Many people wait too long to get palliative care services on board, being whether it's the stigma that palliative care is something that's only to be used when things are going bad. But the fact is that palliative care is that glue that involves really interdisciplinary teams. It involves social workers, nurses. It involves really the oncologists working together and really making sure that the patient's disease is managed, but also their quality of life remains while they're navigating this journey. Palliative care, also really brought on early, is an excellent source for caregivers. We know that the patients impacted with neuroendocrine tumor, the caregiver burden is also extremely high. And if caregiving is not addressed while patient care is, that might be impactful in a negative way for the patient's journey overall. So I say get the service on early, talk to your oncologist so that they can refer you to palliative care early. And then when you are referred to palliative care, I think don't be afraid to ask the difficult questions.
Yeah, I think that's so true and really helpful. I think oftentimes patients may perceive palliative care as end of life, and I think we have to try to reframe that and everything. And being able to have our supportive care services certainly have many of our patients throughout their journey. So I'll go to you, Sheila. Like you guys have an amazing program at UCSF. With wonderful colleagues and everything. How have you seen different ways supportive care services have been able to help, maybe in your practice, to help patients navigate kind of this idea of uncertainty with their diagnosis as well as tests.
Yeah, I 100% echo what Dr. Banerjee had just said about early implementation and bringing in palliative care early on. It may be that the patient at that moment doesn't have a lot of symptoms, but this is a long journey for a lot of our patients, and navigating the psychosocial aspects of things, I think palliative care does a very, very good job of that. I find that there's often this stigma of palliative care means end of life. And I kind of turn it on its head. I like the analogy of it's the umbrella, not the rain. And it's important to have that umbrella before it starts raining. And it's kind of a tool in our toolbox. I also think navigating this and having like psycho-oncology or psychiatry, if that's needed, they've been very, very helpful for our patients in navigating this uncertainty and this possible longer journey than other cancer patients. This is also kind of a rare tumor out there, right? And it could be a little bit isolating for patients. And I do think neuroendocrine tumors are a little bit unique in their patient advocacy and community support that they can have as well. And so I like to try to investigate for my patients, are they interested in that? And can I kind of hook them up with somebody who's going through something similar, a peer? So I think peer support helps as well.
Yeah, thank you for those wonderful insights. I absolutely agree. I think patient advocacy has been able to help some of our patients with their anxiety and everything and how to manage that. I think that's a really good point. I'll move to you, Victoria. I think we've been talking about, maybe how patients face, anxiety or uncertainty and trying to navigate it. But, one of the things that also comes up is certainly their caregivers, family, friends. So it's kind of this idea of, how do you navigate relationships with this diagnosis? Like, should you disclose to your friends and family, particularly, especially if you have children? How has your clinical practice, what have you seen in terms of supportive care services, whether it's social work or others, how have they been able to maybe help to navigate relationships for the patient as they go through this diagnosis?
Yeah, definitely great question. And I think it ties into what Sheila was just saying about advocacy. And I think one of the biggest important things for patients and caregivers is to advocate for themselves. But I do see that need where you need other people to help advocate for you as well. Because it's a lot, on patients, they're going through the symptoms. It's a lot of things to remember. Dr. Banerjee mentioned, caregivers have that burden as well. So anybody extra that's supportive, I've seen neighbors, siblings, anybody that is close enough. And sometimes it's people that you wouldn't necessarily think are as the closest to you end up being the people that have been helpful. So you mentioned children, if you're going through this treatment, you have children at school. Sometimes, other parents have been helpful with drop-offs, pickups, asking for that help or being open, which can be difficult. But I do know there's a lot of forums as well, to kind of organize those around you. I think Caring Bridge, or there's, I think, a couple of other ones that we've talked about in support group, just to kind of help give others an idea of what you might need. But that can be very difficult because sometimes people want to help and they don't know exactly how they can help. But with social work, I think what we try to do is, have those conversations with patients and caregivers to see what ideas can we help with providing, or what communication do they need bridged? Is that, difficulty with communication with family members, with relatives? Sometimes it's with, when you're in the hospital, there's a lot of people on the team. So we've also done family meetings and different things like that. But I think, just trying to tie together and connect you with those resources, I think is where we might be able to help.
Yeah, no, so certainly. And Dr. Banerjee, I know you've been a little bit involved in kind of this area, for focusing on kind of the caregiver and everything. Like, what are some of the things that you've seen, kind of through your focus and everything that might be able to help them in terms of kind of navigating this, relationship with the diagnosis?
Yeah, so actually, Victoria and I are involved in that, and we work Neuroendocrine Cancer Foundation. We actually lead a support group for caregivers once a month. I'll tell you this, that more and more I find that caregivers are as scared as patients are. I see that more and more. They may not voice it because obviously they have to be strong for the patient, but as you get deeper into working with caregivers and really engaging them in the caregiving, we find that they have similar fears. They have anticipated grief. They really are navigating not just the patient's health and wellness, but they're navigating multiple other people in their families. If it's a mom, it's the kids. How do you keep everything in balance? So I often find that if you engage caregivers early in patient care, and you develop that relationship for the patient as a caregiver, not just a spouse, set boundaries and create a healthy caregiving relationship, often things are much more balanced for the patient and the caregiver. Caregivers get thrown into the situation. You don't decide that tomorrow I'm going to be a caregiver for someone with neuroendocrine tumor. So I think them being thrown in the situation along with the patient really leads to a lot of concerns with just caregiver stress, patient stress, just the burden for the patient and the caregiver, not only with the disease, but also in their relationship. So it's really important to talk to them together, but also talk to them individually so that you can really pull out aspects of this disease and this journey that might be a hindrance or barrier to the overall well-being and care of the patient as well as the family. I think that's in the best interest. Often we leave caregivers out until the very last minute, or patients may not want to involve the caregivers due to the psychological impact. But I think it's important to also stress to patients that this is one of those tumors where having caregivers and having support is going to be extremely important for the journey.
I absolutely agree with that. I think, it's so important. I always tell my patients that their survival is probably not dependent on maybe the treatment that I give them. It's actually the level of support that they have from their closest, family members. Because I really see that those patients that have a really good support system oftentimes, do the best in that sense. So thank you for that point. So, I think we'll switch to kind of the next topic that, oftentimes patients encounter. These patients, like you have all alluded, are maybe connected through patient advocacy or other programs. So they seek out multiple different types of opinions. So they can go across the entire country, get different opinions from top academic centers. But something that kind of comes along with getting kind of these second opinions is that oftentimes these opinions will be very different in terms of what's the ideal management, because there might not be necessarily concrete guidelines on the next step. So, Sheila, in your practice, I'm sure you guys see a lot of patients for second opinions or third opinions, or they go to other places, they come back to you. How do you help them, potentially navigate kind of the confusion and the stress that, kind of comes potentially with these different opinions that they might get regarding their diagnosis and treatment?
Yeah, I think this is a super important topic, particularly for this tumor type. There's no easy way, I think, to get through it, but I think there are multiple tools that can help for patients. One is to encourage it. If we're the primary oncology team or primary treating team, but the patient is interested in seeing other people, I want them to feel open to ask the question or get a recommendation. And I think that alone can take a little bit of that stress off for patients and their family or caregivers. So that's step number one. I think also important is to help them sort of figure out how to get out of analysis paralysis. You can have multiple opinions and really get stuck in the weeds. And there's not oftentimes the right or wrong choice. It's the right choice for them in that moment. And one other thing that I think can help is to just kind of let them know that you just have to, in this moment right now, none of us can predict the future, but right now, what is the best decision for you? And we'll help navigate that decision for you. So I think those kind of approaches for patients can just sort of take the edge off, if you will, of the anxiety that can come with these conflicting or multiple opinions.
Yeah, thank you so much for that, insight. Victoria, I would say, maybe go one step further for this, in the sense that a lot of times after a patient gets a second or a third opinion, they might actually be upset with their primary physician who provided the initial opinion. So then they might actually, file a complaint against them and say, like, why did he make this recommendation? Like, when these other doctors had said, other things and everything. And am I really getting kind of the best care possible? So from the social work side, I'm sure you're involved when, kind of these complaints come in from the patient, and certainly there's distress on their end and everything. How do you help them to potentially navigate this distress, but maybe help to also retain that physician and patient relationship for these patients? Because oftentimes they'll still want to be treated by the same initial physician. They're just upset about this differences in opinion that they've been provided.
What I've done before is we're oftentimes, one of the first people that they're talking to about this. And so I definitely listen. And I think that's such an important thing for patients and caregivers both to be heard. And so I think, having somebody to let kind of ventilate those feelings about, I'm confused about this. I'll ask them, okay, tell me more about that. What was your experience, talking with this person versus talking with that person? And sometimes along the lines, what I've seen recently was, like, would you like to have a conversation? And they kind of are, well, you know what? Actually, now that I think about it, yeah, I would like to have a conversation and maybe I could ask those questions, because I'll ask them, what are your specific questions that you're confused about or things that you'd like to talk more about? It depends on the presentation. If sometimes you do get patients or, family members that do still want to go that extra step after having a conversation, and I will let them know, hey, well, this is one thing we can talk to the patient advocate, or, this is kind of how you can file a grievance if that's something that they're still not happy about. But I think the first step for me is kind of asking them more about the situation. And I do find a lot of the times that talking about what their experience has been and having a place to do that and having that heard and accepted really helps. And then bridging that, okay, maybe we can address that. And then I will let the provider know, hey, I spoke with this patient. They have these questions or concerns. Maybe we can address them at the next meeting or their next appointment. And so by that time, I think once they've had that time to kind of get that off their mind, they're able to have a conversation and kind of ask those extra questions that maybe they weren't aware of, that communication behind the scenes or whatever it might be. It ends up being a good conversation.
Yeah, I think open dialogue is really important here, as you highlighted. I think acknowledging the distress and then having an open dialogue is really pivotal, because I think as Sheila mentioned, oftentimes there is no right answer, right, and everything. So I don't think in most cases no one's doing anything incorrectly and everything. So it's not a situation in that sense. So I think those are things to kind of keep in mind and have an open dialogue. I always tell patients, like, if we're not the best fit, then let's see if we can find someone who might be the best fit for you to take care of you, because we truly want the best, for you. I think, one of the other very important topics that, we should discuss is, kind of personal values and goals. So patients individually might have different values in terms of what they want to get from their treatment and their overall goals. So Dr. Banerjee, how do you go about to really have the patient kind of express this, especially if their goals might differ compared to some of their goals of their caregivers or their family members and everything? And how do you make sure that, whatever we do for the patient is really aligned with potentially what they would want?
Yeah, that's really important, especially with neuroendocrine tumor, which, as we know, can have a different trajectory for various patients, right? I think the first thing is building trust and honesty between the providers and the patients and caregivers. If that trust is not built, and often palliative care is a great way to build that trust early on, it's going to be very difficult to get the patient to express really what they want or what the frustrations are at this point in the disease process. I think one of the most important things is to be transparent with the patient and the family about the disease itself and every symptom and every progression along the way. I think if patients don't have that knowledge, it's hard for them to make decisions for themselves. So transparency in really what this disease looks like, what their particular neuroendocrine tumor looks like, perhaps discussing symptom burden, discussing the various treatments is important. Once you have that trust, and once you have the patient understanding what their disease actually means and what it would look like as it progresses, I think that's when you can start discussing what quality of life is for them, what do they want out of the treatments, at what point do they consider symptom burden too high, what is it that they need in their day-to-day to make sure that the treatments are going well. Many times we forget that treatments might be readily available or offered, but sometimes patients have very different situations at home that may not allow for them to get the best treatments possible. What are the barriers at home that are preventing patients from really getting their treatments? Are they not considering various modalities, or when the disease has progressed a lot, are they not considering hospice or even something like DNR because they have children that they're afraid for? So I think there are so many multifactorial issues that really are dependent on what the patient is seeking and what the patient might actually want for themselves. I think if we don't do a holistic assessment of what the patient wants and needs, as well as the environment, that is going to be the most challenging aspect of getting to the core of what the patient wants in their journey and in their goals ultimately for this disease.
Yeah, I think that's so important to kind of keep those, kind of their goals in mind and everything, and what we are trying to do for them through everything that we're offering. And Sheila, I think I'll end with you here in the sense that whenever there's a time when, a patient has to make a decision kind of during their treatment course, oftentimes what they're asking is, what is the best treatment, for me at this period in time, especially as we discuss when there's a lot of uncertainty in terms of not necessarily having one correct answer. What have you seen in your clinical practice in terms of helping patients feel like they are making the best decision for them at that time, while keeping in mind what Dr. Banerjee had said in terms of their ultimately their goals and preferences as well?
Yeah, so I think the rapport is crucial, right? So that the patients feel like they can ask that question to their care team. So, and hopefully over time, we've built that rapport so they do feel they can ask that question and be open and honest. And oftentimes when we're making these treatment decisions, or we're at a point where kind of a turning point, or other modalities need to be considered, could be a glimmer of an opening to discuss or bring up and readdress their goals of care. And I often kind of take that moment to just ask that direct question as far as what's important to them. Just a very open-ended question, because one treatment option or another may align with that a little bit better than another treatment option. And so I kind of feel like that's a window or an opportunity or a door, whatever metaphor you want to use there, to kind of get back to the heart of what the patient really wants and what is most important for them. And that, I think, can be that sort of North Star for a treatment choice that might be good for that patient in that moment.
Yeah, I think that's an amazing point. I think getting to the heart of everything is, really crucial for all of our patients. So I want to thank all the panelists again, for joining me for this, amazing discussion that we're having in terms of navigating supportive care to all the neuroendocrine tumor patients. I think we can all agree that you're not alone in this and everything. There's certainly a lot of support out there from all of us, whether it's social work, nurse practitioners, the medical team themselves, and everything. So really take advantage of that support and everything, because we can help with addressing a lot of the uncertainties that you may have as you go through your diagnosis and ultimately throughout your treatment journey. So thank you, everyone, and look forward to seeing everyone soon.
Thank you.
Thank you.
Thanks.